Hello, this is naturopathic Dr. Brett Butterfield, and I'll sometimes get questions about natural birth control. What does that really mean? There's not really an herb or something that you can take that will keep you safe from unwanted pregnancies. It's going to do harm to your body because a healthy body is a fertile body. So if you're wanting to avoid unwanted pregnancies, I'd recommend that you take some more mainstream birth control measures. However, some birth control is much more likely to affect your health negatively than others. And so let's talk about the ones that work best. And the first one is just barrier methods birth control. That's going to be male and female condoms, diaphragms, things of that nature. Okay, you can learn more about all birth control on cdc.gov, but naturopathically, that's what I recommend is barrier methods. The second one that will have some impact, but certainly not as much as other methods, would be a copper IUD. IUD means intrauterine device, and it's where they insert a small copper device in the uterus. Okay, and so you'll need to work with a physician on that. And that usually lasts for up to 5 years, and it can work really well. The last one would be if you are at this point where you're certain that you don't want to have kids anymore, then you can get surgery. For women, that'd be tubal ligation. For men, that would be a vasectomy. So is what we're aiming for with these methods is we're avoiding introducing exogenous hormones into the body. So women's birth control is based almost entirely off of giving that woman either progesterone or estrogen or some combination thereof. And it's really going to affect the natural harmony and balance of the woman's body. And there's, you hear about this all the time, how strong it can affect women's bodies. A lot of times they'll put on a significant amount of weight, or they'll have their mood will change. Oftentimes they feel like they're a different person, and they can't control the mood swings and that type of thing. And the effects of hormones are so far-reaching in the body that I'd really recommend that you stay away from hormonal contraception if possible. Now, none of these methods are 100%. It happens often that people will be using one or even two forms of birth control, and they still get pregnant. So you want to be aware of that, you want to be ready for that. I do not recommend the calendar method or the rhythm method, and that's when you're trying to plan out what time of the month you're fertile, the woman is fertile. And when I was taking my anatomy and physiology courses, my professor said, yes, we have a word we use to describe people who use the calendar method. We call them parents. And it's really true, you need a very healthy body to have a dependable cycle that you can take to the bank, and I really just don't recommend it if you're wanting to avoid an unwanted pregnancy. So what I've described here are methods that I would prescribe primarily for monogamous couples. So I haven't touched on risks of sexually transmitted infections. I'm going to cover that in the next video.